Hi, I'm Dr. Sidhu, and I am a family practice and lifestyle medicine doctor. I help people heal with finding the root cause and holistic and evidence-based tips. I'm also the founder of Spring Monarch Primary Care, which is a direct care clinic here in Houston. Today, we're going to talk about cold and flu tips, natural ways to heal your body. Let's dig in. First, we've got to talk about the difference between cold and flu. They are both viruses, but typically the common cold starts slow. The symptoms are sort of mild and then gradually increase over time. We've got runny nose, congestion, maybe a little sore throat. Meanwhile, the flu hits you pretty quick. Most patients can tell us exactly when their flu symptoms started. And you may start right out the bat with fever, body aches, chills. We may have some congestion, runny nose, but that's not the predominant symptom. Now, since they're both viruses, they can both be managed at home, but we'll talk about today how to manage them at home and when to see a doctor. So first up is rest and sleep. Rest is medicine. When we are resting, when we are sleeping, our immune system can do what it needs to do. So if you've got a cold, it doesn't mean you necessarily need to stay home, but cutting back on activities, taking it a little bit slower, laying on the couch a little bit if you can, sleeping a little bit extra can really help with those symptoms improving. Next up, we have hydration. So when we sweat, when we have fever, when we breathe fast, when we're congested, we lose fluids. So hydration is a huge part of getting better when you have a cold or flu. You can hydrate with fluids, you can hydrate with soup. I like to tell my patients, as moms, no one's going to keep bringing us stuff, right? So we've got to have something by our side, especially when we don't feel good and don't want to keep getting up. So I like to tell my patients to warm up some water and put it in a thermal mug and put some honey in there and squeeze some fresh lemon. With the honey, you're getting a little bit of glucose, and with the lemon, you're getting some vitamin C and antioxidants. Sip on that, and that's a great hydration mix for you when you have a cold, is what I tell my patients. Also, if you throw a little bit of salt in there, you're going to also get a little bit of that sodium that you might need when you're sweating everything out. So that's my favorite tip for hydration when people have colds and flus. Now, the next thing we need to look at is overall nutrition. So we really want people to avoid calorie empty foods, high junk foods, high sugar foods. We want to be eating nutrient dense foods. And what do nutrient dense foods look like when you have a cold? We want to focus on foods that have a lot of vitamin C, a lot of zinc. And so we're looking at whole food soups, fruits like oranges and kiwis, if your throat can handle it. Sometimes if your throat is sore, you want to avoid that. If you are into Eastern medicine, I love to recommend ginger and turmeric. So drinking a tea with ginger and turmeric can be really helpful. And then if you've got a really low appetite, you don't feel like eating, that's when I tell patients to really focus on that hydration with that honey, lemon water and salt, because you will still be getting some nutrients and some hydration. So if you've got a low appetite, then smaller, frequent, liquid-based meals are perfect. So now we've talked about what to drink, we've talked about what to eat. Let's talk about getting people feeling better with the symptoms. For sore throat, I like to stick to the natural remedies if we can. So I like to recommend saltwater gargles. I like to recommend that honey water to soothe the throat. The honey coats the throat and can help with the sore throat. And then if you've got congestion, we're always going to recommend the saline sprays. A cool mist humidifier at night when you sleep is a great way to open up the airways. And then if you've got a cough, I tell my patients honey is great for coughs. And then if you're leaning in towards Eastern medicine, cloves can be really helpful for cough too. So making tea that has cloves in it, again with the turmeric, ginger, and cloves, is a great way to soothe the throat for the cough. For when you've got body aches, if we're talking about natural remedies, I'll get to medications in just a second. But for body aches, I do love warm baths and heating pads. Now, if you've got fever, I do tell my patients to stay away from warm baths or heating elements if you've got fever. That's not something that'll raise your body temperature further, and you don't want to do that. Now, let's talk about over-the-counter medication for relief. I tell my patients you can take acetaminophen, you can take ibuprofen. Just remember that acetaminophen doesn't work that well if you're dehydrated, and then ibuprofen can be dangerous if you're super dehydrated. So I do tell my patients that hydration is first step. Oftentimes, if there's fever, I tell my patients to alternate with the acetaminophen and the ibuprofen because they may not last the full 6 to 8 hours like it says on the bottle. And if you're alternating every 4 hours, patients get more relief over long term. But again, hydration is super important with those medications, and it's really important to remember not to stop or start any medication without talking to your doctor. Medications can interact with each other. People may have kidney issues, so we want to talk to our doctor about the best medications for ourselves. When we're talking about over-the-counter medications, I really also do tell my patients to stay away from the bazillion options of cold and flu medicines. I don't like them. If anything, I'll tell patients to take Mucinex to thin out the secretions. But I'm not a fan of that entire section of the cold and flu medications at the pharmacy. If you want to know more on my thoughts on that, let me know in the comments, and I'll make a whole separate video. But I'm not going to get into that today. Now, what do we want to avoid? In the beginning of the video, I explained that the common cold and flu are both viruses. And for that reason, antibiotics don't work. I know it's really hard to understand that you don't feel good, you come and see the doctor, you want them to give you something. I totally get that, but antibiotics are not the answer. Number one, antibiotics are antibacterial. And if you've got a virus, you're not going to impact viral replication or viral healing with an antibiotic. Secondly, antibiotics can actually do more harm than good. Antibiotics can actually disrupt the gut microbiome for up to 18 months. That means if you take one course of antibiotics, your gut health may not be the same for 18 months. Now, absolutely, if a patient has a bacterial infection and they need the antibiotics, I'm going to ask them to take the antibiotics because we don't want something to happen before those 18 months because we didn't get a hold of their bacterial infection. But to just be taking antibiotics every cold and flu season when you get a runny nose, congestion, it's just not smart. It doesn't do our body good overall, and in the long run, it may actually impact healing. When to see a doctor. I want my patients to call me when they have had fever for more than 1 or 2 days. I want them to call me when they've had overall symptoms for more than 7 days. I want patients to call me when they've had facial pain, especially localized to one side, for more than 3 days. Also, I ask patients to call me when symptoms seem to be getting worse rather than better. Also, if a patient is pregnant, if they're super young, they're immune compromised, they're older, or they have other chronic issues going on, or they're undergoing some special treatments, then I want patients to call me sooner than later. Even if I'm not going to give them antibiotics, I can guide them on how to get better faster so we don't have to do the more aggressive treatments. So, today we talked a little bit about what to do for natural tips for cold and flus and how to avoid certain things. Remember, rest, hydration, nutrition, perhaps over-the-counter medications, and skip the antibiotics for all the reasons that we talked about. And I'm going to say again to skip a lot of those medicines that patients see over the counter. Again, if you want to hear more on my thoughts about that, please let me know in the comments, and I'm happy to do a whole video on that. I feel very strongly about those medicines doing more harm than good. But if you liked this video, please subscribe and let me know. If you want to see more videos like this, and that'll tell me that it was something that was helpful for you, share with a friend who you know needs to see this. And if you want to work with me, check out my practice link in the captions, and I will see you in the next one.